In this video, we talk about 2 hidden Medigap traps that most retirees don't know. Coming up next on Holy Schmidt.
Holy Schmidt!
Gang, we spent a lot of time on this channel talking about Medicare Advantage and some of the downsides with Medicare Advantage. We don't spend a lot of time talking about Medigap because there's a lot less to worry about with Medigap, but there are at least 2 issues that you need to be concerned about, and that's what we're going to talk about next. When you sign up for Medicare Part B at age 65, insurers can't ask you underwriting questions. It doesn't matter how healthy or sick you are, they can't ask you a single question, so you get approved regardless as long as you follow the rules. After that 6-month period of time, those same insurers can deny you, they can increase your premium, or they can implement what's called pre-existing conditions, which means that you have to wait a certain period of time before those medical conditions are covered on your Medigap plan. At the same time, some Medigap plans in the United States can price themselves so that they get more expensive the older that you get. According to the CMS, that's how the majority of Medigap plans are structured. The premium continues to go up as you get older. It doesn't matter if you're healthy or not. You pay more as you get older. By the time someone reaches age 75, for example, it's not uncommon for their premiums to be 40% higher than they were at age 65. That's before you account for inflation. And here's what turns this into a real problem. If you decide to switch insurers, the new insurer can ask you health questions. And so if you have health conditions, it's not an automatic transfer from one insurer to the other in many cases. A lot of retirees are locked into a Medigap plan that continues to get more expensive with age, and they have no way out. In this video today, I'm going to cover both of these issues, and we're going to talk about options to help mitigate the problem, things that you can be aware of up front so that you structure the deal, I guess if you want to call it that, in the right way when you go on to the plan. We're also going to talk about some of the states that protect you better from these issues because the limitations that we're talking about are at the federal level, but some states say if you're going to do business in this state, you have to make it easier for our retirees. And so knowing which states those are is of paramount importance. By the end of this video, you'll know when these doors are open, when these doors are closed, and how pricing works in real dollars. All right, let's get into it. The first trap is the Medigap open enrollment period. Here's how it works. The day that your Medicare Part B coverage begins, you have 6 months to enroll in a Medigap plan without any underwriting. During these 6 months, federal law says that Medigap insurers can't turn you down, and they can't increase your price based on your health. They can't make you wait for coverage of a pre-existing condition. You have what's called a guaranteed issue right. But here's what most people miss. If you delay Medicare Part B because you're still working, that 6-month window doesn't start until you start Medicare Part B. If you're age 67 or 70, it doesn't matter, as long as you're on a credible plan, of course. The clock starts ticking when you enroll in Medicare Part B, not when you reach age 65. But it's important to note that you have one shot at this, and that's when you enroll in Medicare Part B. It's not like other aspects of Medicare where something comes around every year, like the Medicare annual enrollment period in the fall, for example. As an aside, that fall window is for switching Medicare Part D drug plans and Medicare Advantage plans. It has nothing to do with your Medigap rights. Once that 6-month window closes, you're at the mercy of the insurance companies unless you're in one of a few exempt states. And the insurance companies can pull your prescription history going back several years. They can ask you medical questions. They can deny you. They can rate you higher. There are a lot of things that they can do that aren't very good. And unfortunately, when retirees miss the window, it's because they don't know the window exists. Because it's a pretty easy decision if you know that this window has a limited time. Now, the second Medigap trap. Now, this one's a little bit sneakier because most people don't understand how Medigap policies are priced. So let me explain to you how they're priced. The first is an attained age policy. The price is set based on your age. The second is the issue age policy. The price is set based on the age you were when you came on the plan. And the third is community pricing, which is one price for everybody in the community, no matter what the age. Attained age rated, issue age rated, or community rated. those are the three pricing points. Now, for a lot of people, they sound similar, but they're definitely not similar, and that's the entire reason we're having this discussion. With an attained age policy, your premium often goes up with age. The increase happens on your anniversary, usually anyway, and it's typically low single digits plus inflation. With an issue age policy, the price is set based on the age at which you took the policy. It can still go up for other reasons, but not based on your age. And with a community-rated policy, it's not based on either one of those. Everybody, whether you're 65 or 85, is paying the same exact premium. Now, according to the Centers for Medicare and Medicaid Services, the vast majority of policies sold are attained age policies, so they can go up every year. And of course, because they can go up every year based on your age, they always look, or almost always look, the least expensive when you start at age 65. So if you're looking at three different price points and you're looking just for the lowest possible price, you often pick the attained age policy, and that's the trap. So with an attained age policy, it's not uncommon for someone who buys a policy at age 65 to see the price double by the time they reach 80 between price increases and inflation. If you want to switch to another carrier later, in most states you have to go through underwriting, and if you're not healthy, well, then you have to pay more anyway. Gang, Medicare can be confusing. It can be overwhelming. Ask anybody who's age 65 or older, and they will tell you that it's true. People will spend hours of time looking at plans. They'll make a choice thinking it's the right plan, and then they'll find out that they missed something, and it costs them hundreds, if not thousands of dollars a year. On this channel, we have 3 affiliate relationships. One is our trusted Medicare partner, Chapter. Chapter is the only national advisor that looks at and recommends every plan. They're totally free to you. It doesn't cost you more to use them than going directly to the insurance company. They save their clients an average of $1,100 per year. It takes about 20 minutes of your time, and they're really easy to work with. So if this is of interest to you, give them a call at 440-703-1224 to see if they can help. Now, here's where geography becomes a very important part of your Medicare decisions and outcomes. The federal law states the minimums that the insurance companies have to abide by, but the states can, and some do, put more restrictions on the insurance companies. And it's important to know which states do that, just in case you happen to be in that state or moving to that state. Let's start off with pricing. Some states have come in and said, no, you can't use attained age pricing. The list includes Connecticut, New York, Massachusetts, and Vermont, as well as a few other states. In those states, insurers generally must use community-rated pricing, which means that your premium isn't any higher than the person down the street. States like Florida and Georgia, for example, use issue age pricing, and other states have similar rules. In those states, the price is based on the price you paid when you bought your policy, with adjustments for inflation, for example, but it doesn't increase with age. Now, let's flip over to the enrollment window trap that we talked about. KFF has data that shows that some states have better protections than the federal minimums. In Connecticut, New York, and in practice Massachusetts, you can switch from one Medigap insurer to another at any time during the year. And there's no medical underwriting. It doesn't matter how long you've been on Medicare. In Maine, there's a 1-month window where insurers must offer Medigap Plan A on a guaranteed issue basis. Still, other states have what's called the birthday rule, where people can switch from their current plan to a plan that's either equal to or lesser in coverage on or around their birthday. California, Idaho, Illinois, Nevada, and Oregon are several of these states. Each of these state-level windows gives you a second chance to escape these traps instead of being stuck after you go on your Medigap plan. If you don't live in one of these states, the single most important window for you is that 6-month window once you start Medicare Part B, because the decisions you make at that point in time could carry with you for the rest of your life. Let me give you some numbers just to highlight the importance of this. According to KFF, the average Medigap policyholder pays about $2,600 per year in premiums. That's roughly $217 per month on average across all ages and plans. But using the average hides the trap. According to Policy Guide, two people with identical profiles in identical zip codes applying for the exact same standardized Plan G coverage can often see a difference of $50 or more per month between carriers. Same plan, same benefit, different price. Now multiply that times 20 years, and the difference can be many thousands of dollars in cost difference. And that's before you account for increases. Policy Guide also says that increases for attained age policies range from 20 to 40% higher plus inflation. And if you've never gone through Medigap underwriting, here's what it actually involves. The insurer provides you with a health questionnaire with a few pages of yes or no questions about your specific health conditions. And these are the big questions. Have you ever had cancer? Have you ever been on dialysis? Have you ever been treated for a heart procedure? Are you currently taking certain medications? And some of the questions go back 24 months, and some of the questions go back forever. The exact list varies by insurer, which is why someone with health conditions can be approved one way with one insurer and another way with another insurer. And increasingly, a big part of that questionnaire is a list of your prescription drugs. It didn't used to be that extensive, but it is becoming more and more common. And that list becomes the basis for approvals, rate increases, or denials. Increasingly, they aren't even getting to the medical exam stage, which basically means that if you've ever been on a medication that the insurer flags, you can be turned down before anybody even looks at your chart. One last point, even if the insurer accepts you, they can still impose a 6-month pre-existing condition provision, which means that your condition isn't going to be covered for your first 6 months on the plan. There is one exception to this, and that is if before applying for the Medigap plan, you had what was called creditable insurance, basically insurance that was provided by an employer with 20 or more employees, either your employer or your spouse's employer in most cases. There's also something called guaranteed issue rights. Federal law does carve out a handful of very specific situations where you do have guaranteed issue rights. The most common ones are these. If you lose employer or union coverage that was supplementing your Medicare, you generally have 63 days to buy a Medigap policy. If your Medigap insurer goes bankrupt or commits fraud, you have a guaranteed issue right to switch to another insurer. If you tried a Medicare Advantage plan when you were first eligible at 65 and you want to switch back to original Medicare with Medigap within 12 months, you have a one-time trial right. And in birthday rule states and in community-rated states, you may have a fresh opportunity every 12 months. But we don't know what the future holds, and none of these can be guaranteed to protect you. So the best way forward is to know exactly what can happen to you from day one. Now here's the big picture. With Medigap, there are 10 standardized plans from A to N, with the most popular one being Plan G. But the rules about when you can buy, when you can switch, and pricing increases aren't straightforward. So what can you do? Well, step one is understanding exactly when Medicare Part B starts for you. That's the start of your Medigap open enrollment period. Mark it on your calendar and also mark the end date too, 6 months later. Step two, before that window even opens, get a price for your chosen plan. For most people, that's Medigap Plan G, and get it from several different carriers. The same plan can be $50 more or less depending on the carrier that you choose, but understand that these are standardized plans, so the coverage is identical. Step three, ask each one of those carriers whether their plan is attain age rated, issue age rated, or community rated. If you live in a state that allows for attained age pricing, that matters more in most cases than just about anything else when it comes to your cost. Also check your state. As we talked about earlier, some states prohibit attained age pricing, and others provide you with other options which will keep you safe in the event you need to switch carriers. And by the way, this changes over time, so the fastest way for you to do this is to talk to a licensed Medicare advisor. The next step, if you're beyond that 6-month window, don't automatically assume that it's closed. Talk to somebody and see what your options are, because a lot of times there are options available, and knowing your options is extremely powerful, whether you use them or not. If you like this video, check out that video. The first 2027 Social Security estimates are out, and here's what they say. Also, if you have questions about Medicare, don't forget to talk to our partner chapter, 440-703-1224. This is Geoff Schmidt, and I will see you in that video right there.